Welcome to this episode of Pharmacy Pathways. Today we are doing something new. We are interviewing the pharmacists on site. I am seated with Dr. Tai Nguyen at Professional Arts Pharmacy, and we are going to be talking about compounding pharmacy today. And we happen to be sitting in one of the rooms where the magic happens. And Dr. Tai is going to talk to us about his journey to becoming a compounding pharmacist, what the day-to-day role looks like, and he also happens to be the owner. So he's going to be able to show us or speak to some of the ownership that goes into running a pharmacy, as well as still being on the ground and being on the front lines. So without further ado, I introduce to you Dr. Tai Nguyen.
Thank you for the introductions, Dom. Yes, so my name is Tai. I graduated from the University of Georgia back in 2015. I worked a couple years as a pharmacist, and then I joined Professional Arts Pharmacy in 2018. Started my training with PCCA in Texas and work alongside my pharmacist to, refamiliarize myself with compounding and seeing the techniques and seeing the methods of procedures of compounding, get the medications from powder form into different formulations, capsule, mini tablets, treats, trained in sterile compounding at PCCA in Texas, and seeing how eye drops and injectables are made. It's a pretty cool experience.
Your pharmacy is really cool because you have various patient populations that you serve. And when I was looking on the website, you have about like 30 different specialties that you can cater to. So can you speak upon the different patients, human and non-human, that you service, and also the specialties that you offer?
Yeah, with compounding, we work with veterinarians, podiatrists, dermatologists, plastic surgeons, dentists, internal care, psychiatrists, just so many different specialties. We would sit here for hours to name all of the different specialties that we work with. And with compounding pharmacy, there's different niche in compounding as well. So there's just so many specializations out there, all similar in some aspect, but what they use the medication for is a little bit different. Just seeing how you can make such a difference at the different specialties and the different areas of medicine. That's pretty cool with compounding.
For those who aren't very familiar with compounding pharmacy, could you give us like layman terms, like we're talking to a middle school classroom? What is compounding pharmacy, and what do compounding pharmacists do?
Okay, yeah, I get these questions a lot. What is compounding pharmacy? So with compounding pharmacy, we take the pure drug substance, the powder. Let's say you have ibuprofen, the powder, and you have a pet, or you have a pediatric patient, or you have someone that needs special dosing, with either poor renal functions. You take these powder medication and you alter it and you compound it. You make it into a formulation that can treat the individualized patient. So it's very specific. You're trying to treat for that particular patient, not a group of patients. Or you say, hey, this person has this much body weight, this BMI, this dose that you're trying to target. So let's say, for example, for a pediatric patient, we can make like ibuprofen 7.5 milligram per capsule. So, you don't see that at a regular pharmacy. In this case, we would get the prescription from the doctor and make that 7.5 milligram capsule of ibuprofen for this particular patient. But if you have a child that is sick, or allergic to gluten, or allergic to different preservative or dye, or they can't take the commercial versions, or they need to have the dose tailored to the specific needs, that's where we comes in.
That is a good point. Manufactured medications coming from the large companies, the large factories, they're doing standardized processes, and the fillers, binders, dyes. Some people can't tolerate those, and that is where you guys step in. So that is a nice lead into the next question. What would the world of healthcare look like if compounding didn't exist? How would that impact patient care on a large scale?
I think with that in mind, with that question, it's very hard to have individualized therapy. and individualized treatment. Like you have all of these specialties or subspecialties in medicine. Not everybody is the same. Your body, your chemistry. Without compounding, it's kind of hard to have like targeted therapy. If a patient is allergic to something, if a patient cannot take a commercial product, is very limited. I mean, you're not going to go to the drug manufacturer and say, hey, can you make it without the dye and preservative, because they make them in big batches, like millions and millions of capsule at a time. And so if you telling them to do it for each of a single patients that, hey, I'm allergic to corn, I'm allergic to dye, you would have so many different machines or out there that, the company was like, why are we mass producing these things that only treat 4 or 5 patients? There's just not many.
It makes sure that everybody has access to treatment, but even animals.
For sure. Yes, a furry companion. Yes.
Yes. So you clearly have to have a different set of knowledge than the average pharmacist who's going into the retail setting, the hospital setting. So what all do you have to, as compounding pharmacists, have to learn in addition to the regular curriculum in order to become an expert in compounding?
I would say, you start off with learning in school. If your school has compounding, or they call them wet lab, where you go and you perform the procedures. I know back University of Georgia, they has back when I was in school, they had those labs where you would go in and you would look at the prescription order and you would compound the medication from scratch. From there you take that knowledge, that foundations, and you built upon it. You would go on to work in a compounding pharmacy and learn the different procedures, technique. Get in contact with PCCA in Texas and start your compounding training. They're a great resource to have. You will have a lot of questions as you build your knowledge and your experience. Not all schools will have compounding training or compounding pharmacy, so you pretty much, if you go to those schools that don't have the curriculum with compounding training, then you may have to kind of study and learn on your own times. These days you can learn anything online, so pretty much like compounding techniques and stuff, you can learn all of that online. But I would say a good source is to contact PCCA after you start your career as a pharmacist and say, hey, I want to specialize in compounding, and go from there.
And in these training programs, what are you learning? Are you having to learn what the standard bases are for compounding solutions and creams and powders? And then how might your understanding of the medications be a little different than the pharmacist who's kind of just handing out a tablet that's already put together by the manufacturer? What are these training programs teaching you?
So the compounding programs will teach you, stuff that you've seen before, but you haven't worked on it. The compounding programs, for maybe so long, maybe you were in school or training and you've never seen this in real life, you will get to see the different formulations. Like Dom said, you get to see how capsules made, how tablet is made, how lollipop is made, troches, suspension, solutions, IM injectable, IV injectable, eye drops. So you basically see the medication start from step 0 all the way to the final step where it's pre-packed and it's turned into a capsule or whatever other formulations that you would have, rather than versus a pharmacist in retail, where you don't get to see the starting product. You don't get to see the powder. You don't get to see, hey, this is the empty capsule, this is the powder. I have to pack them together. I have to use filler. I have to use bases that doesn't cause allergic reaction to the patient. They don't get to see that. They just see a bottle with capsule or tablets on the shelf, and
Yeah.
that's how they see. So as a compounding pharmacist, the cool thing is you get to see how medication is made from all the way from the beginning to the very end.
Yeah, I think that is so cool. And I'm sure that that's hard to memorize all of these formulas. So they probably have resources for you that you can constantly reference when you're finding new recipes. Excuse me. I wanted to also ask you about certifications. If there's certifications that are required in order to practice, kind of like how clinical pharmacists sometimes can go even after their residency programs and get certified in certain specialties. Do they have that for compounding?
Yes, they do. They do have certifications. It's not a requirement per se, because at the end of the day, as long as you get inspected by, the FDA, the Board of Pharmacy, these agencies, and, make sure that you have your procedures in line. It's not a requirement, but it's recommended for you to get it. Some insurance company will require certification for you to build the insurance. You can get the certification from, different areas. You can get them from PCCA, you can get them from PCAP, you can get them these from different agency. Um, as long as, I think as long as you have the training, you can get it, as they just have a list of requirements that you have to follow and submit. Like, hey, I have to do this, do that. I'll just kind of follow the steps. There are pharmacists out there that are, specialize in compounding, and they have the certifications. I would say probably the number one training that you can get besides, getting the certification is work at a compounding pharmacy and learn, how to make the different formulations and see how the day-to-day operation works.
Yeah, very different when you actually do it versus read the directory.
Yes.
I in my compounding lab, I had to redo certain formulations quite a few times in order to get it. So I liked it. I thought it was so cool. The boiling points and the melting points. It was taking me a little bit to grasp, but I enjoyed the process, and I had a serious appreciation for the chemistry, that the knowledge of chemistry that's required, and how sensitive these medications are to sometimes even just a degree or two off, exposure to air. And just one little mishap can either make something ineffective or hazardous. And I had a true appreciation for that. Back to specialties, because as I mentioned on your website, you have like 30 different things that you're offering, specialties you're offering. Can compounding pharmacists choose to just go to one specialty and focus on that particular one, or is the compounding pharmacist more so expected to be a jack of all trades?
Yes, you definitely can specialize in a specific area of medicine. You can, but at the end of the day, is as your business grows, you will get referral to other specialties, and your business cannot grow if you just isolate yourself into a special niche. You definitely can do it, but what's the fun in life if you just do the same thing over and over again, and you're not going to learn and grow and see how the other specialties, what do they use the medication for, what type of medication they require. So like I said, you definitely can do it, but I wouldn't recommend.
What are different settings that compounding pharmacists work in? So we're sitting in your pharmacy, which is, accessible for people to just walk right on in.
So you have different locations. I've seen compounding at the hospital where they have to make, IV drips. They have to make TPN. It can be anywhere. It can be a standalone business in a standalone building, inside a commercial building or inside a hospital. You can find compounding pharmacy everywhere. You have that job stability. Say, hey, I can work in this state, or I can work in this environment. Your skill can be transferred to different areas of pharmacy.
The next question that I want to ask you is about regulations. So you mentioned that when they're doing the mass productions in these large pharmaceutical companies, that the FDA is tightly regulating this process. So how do compounding pharmacists assure that they're under, you know, safe practices when it comes to manufacturing and making sure also packaging with the medications? How do you guys ensure that you're following safe protocols? Is there any governing body that is following up from time to time to, check in and make sure that the pharmacies are under compliance?
Yeah. So, with compounding pharmacy, just like any pharmacy, you get inspected, once a year or twice a year by your state board of pharmacy. You also get inspected every now and then by the FDA. If you work with controlled substance, the DA may come by and inspect your controlled substances. So you have different governmental agency that inspect your compounding pharmacy. How you remain compliant is, of course, you do quality analysis. You try to make sure that you have all of the documentations in line, you have your certification in line. I say the easiest way is just to go and get like the inspection checklist from, the State Board of Pharmacy or the FDA website and say, hey, these are the things that they look for. How's the temperature of the refrigerator to keep the medication? Medication that are out of date, how often are they pulled? Where do you get your medication from? Are they USB source or NF source? Your compounding powder, is it USB or NF source? Just different things that if you look on the checklist, it'll tell you. And then of course you have quality analysis where you would test your capsule or your suspensions. You would send it out to a third party and get potency testing. You can get sterility testing. You can get stability testing. And these tests typically done at least, once or twice a month or even weekly. And they tell you about the medication that you make. They tells you, hey, this drug has this much potency, or, is it sterile? And, from there you would, once you get your results back, you would take that and change your practice as needed so that you can remain compliant. And like I said, so you have these third-party resources that can help you test your medication to make sure that, again, they are sterile, or they have like the correct potency, or they have the correct stability, testing for how long you can keep them.
I'm sure that's really important for when you have an expected volume that you prepare for in advance. Can you talk about how you approach, a specific order for maybe just one medication, like 7.5, solution of Tylenol or ibuprofen, versus that you have this particular customer who needs X amount of this on a monthly basis?
Yeah, so I think they call that anticipatory compounding.
Yeah.
Basically, you anticipate a certain amount of prescriptions or prescription volume coming in. Typically, the rules of thumbs is we like to keep about 2 to 3 weeks supply worth. You don't want to compound more than that because, of course, you run into not just the regulations, but medication after you compound it. After you compound the medication, they have a specific beyond use date. So the beyond use date will start from the day that you make the medications, and you don't want medication to go to waste. And let's say if a medication has a 35 days expiration date, you don't want to make so much that you have to throw away a bunch of medication after on the 35th day. So what you want to do is you want to make enough for about 2 to 3 weeks. And not every medication you want to do that. You want to basically run a report once a month, preferably. Just say, hey, these are the top movers medication, and this is how many capsule or how many milliliter of liquid that we dispense, and kind of look at that and use that as your guide. Say, hey, I see, for the example, let's say I see 7.5 milligram of ibuprofen, 500 capsule get dispensed every 2 to 3 weeks. Man, you can make 400 to 500 just to keep on the shelf. Use the dispensing log to keep a history of your inventory, and that's the best way to keep track of medication that you anticipate of coming in on a regular basis. We call them fast movers.
Yeah.
Compounding.
Fast movers up. But
yeah, like fast mover items. Like you have fast mover in retail where maybe they have the top 10 or 20 drugs that consider fast mover. Same thing with compounding. We keep about, maybe 10 to 15 medications that are very high demand, and we make them enough for 2 to 3 weeks.
Do the fast movers vary per pharmacy?
Oh, yes, definitely. Because depending on your specialty, really, you work with, let's say you work with a lot of dental offices, your fast mover would be different than someone who's worked with a lot of dermatologists or podiatrists, because, they treat different areas of patient population, so the medication won't be the same.
Yeah. You already kind of hit on a lot of the areas where we need to make compounded options. I had a question specifically on that, but you already hit a lot of the examples. Can you also talk about where compounding pharmacies step in when it comes to drug shortages? So I know, for example, that there has been a large pickup in GLP-1 compounding, especially when there was a shortage going on. But not even as that an example, but in general, how can you guys step up when there are mass drug shortages going on? Excuse me. I hope you don't mind if I cut in for a moment.
Hurry up.
Number one, thank you for watching. I hope you're learning something new in this episode. Number two, which is the reason I'm here, is if you don't mind, could you be so kind and like this video or hit the subscribe button?
I mean, I've always subscribed.
By subscribing, you're letting YouTube know that my content is providing you value, and that ultimately helps the channel grow and reach more people who need to hear these conversations. You can also subscribe to the Pharmacy Pathways newsletter to get access to exclusive episode content. Newsletters go out in the same week of the episode. You'll receive a structured summary of each interview, expanded guest bios, and exclusive sneak peeks of future episodes. Subscribe at pharmacypathways.org. Link is in the description. Oh, and one more thing.
Hurry up!
If there's a specific topic or career you'd like to see featured, you can let me know by filling out the audience feedback survey on my website. And if you'd like to be a guest, there's a guest sign-up form on my website as well. Both of those links are in the episode description. Okay, let's get you back to the show.
With that, of course, we keep, they call them the shortage list, and the FDA keep track of that list on their website. You can actually go online and look up the FDA shortage list. Any medications that are on there, basically for whatever reason, supply chains issues, you're allowed to compound. And so, when we check that list probably once or twice a month to see, hey, what medications are out there. And then we would get calls from provider offices looking for these medications. So like I said, the list changes month by month or even week to week. And you just have to, be on the lookout. Sometimes the shortage the gap is so small that you don't really need to compound it. Let's say if it's on, if the medication is only missing from the market for a couple months, then they may have a surplus inventory elsewhere to kind of fill that niche. But if the medication has been there for maybe 6 months or a year, it's kind of hard for someone to kind of keep that much inventory. So what we do is, as compounding pharmacies, we would step in and kind of fill in that role and say, hey, we can supply you with the medication that's on the FDA shortage list for the time being, until once the medication is pulled away from the shortage list by the FDA, then you would stop compounding it.
When it comes to the dynamic between a compounding pharmacy and its clients, which can be provider offices, but also individual patients, I'm curious how you guys, and by you guys I mean compounding pharmacists, derive to certain solutions. Do you communicate and creatively brainstorm with your customers the ways that you can get around the problem and provide a solution? For example, if there is a very rare allergy, or if someone can't take the medication by a standard route, who is more likely driving the process of coming to a solution?
Yes, so that's a good question. So basically, I think the initial conversation would start between the client and the doctor. The doctor would say, hey, I have this allergy, or I have this needs that I can't, get at a regular pharmacy or at a conventional pharmacy. And, the doctor would speak to the pharmacist, and we would kind of plan the best route of treatment for the patient. Like you said, if some patients, they would take medication via a GI tube or E tube or anything like that. The doctor and the pharmacist would work together and say, hey, let's try to treat this patient with this medication or with this formulation.
Mm-hmm.
So I think, but the initial conversation would probably start between the patients and the doctors. And then from there, the doctor would consult the pharmacist, especially a compounding pharmacist, and we would create a solutions for the patient.
How much creativity is involved in these approaches versus standardized procedures and just going to the textbook or the resources?
You definitely would have creativity, because you get questions from doctors all the times of, hey, I have this special patient, and this is like the list of requirement, and you kind of work trying to meet all of the requirements, but at the same time, trying to get them the correct medication and dose. Especially, we get a lot of patients with pets, especially cats. Say, hey, I have this cat who doesn't like oral medication, can't give it injectable, you can't touch it, or you can't chase after it, or whatever reason, you have to find a way to get the medication into the animal and say, hey, maybe, maybe consider transdermal or maybe medicated pet treats or something like that. And those special needs come up pretty often when you work as a compounding pharmacist.
How often are you responsible for checking what's new and what the new regulations are to make sure that you're in compliance, and also being with the times with how medication is advancing?
So like I say, I think this kind of go back to the one of the first few questions that we talked about. Of course, PCCA is a very good resource to have, but they have these meetings and conferences where in CE training that would keep the pharmacists stay ahead of the information. It's like, they will tell you, hey, these are the new changes that are coming. How would you prep your pharmacy? And, they would send out like monthly newsletters. You also have like virtual conferences with your rep colleagues from other states, kind of learn from each other and stay ahead of the curve and seeing what coming down the pipeline and what changes we need to make to our practice to remain compliant.
And when you are certified, do you have to meet a requirement of a specific amount of CEs pertaining to compounding pharmacy?
I think the requirement is about, I think, average to 30 to 60 hours of CE training. Some of the hours you have to do it in live training, you have to perform in a lab. But most of the training would probably be, sitting in front of a computer, but then there's a portion where you would go out, like I said, maybe go to Texas and perform the training and, like the hands-on portions. And you have to do that typically every couple years. And, that's how you get your certification at CE.
Compounding pharmacist has to make sure they're getting their CEs in their state of practice, but then also within their specialty as well. Well, I want to shift now to covering more of like the day in the life of a compounding pharmacist, and then also we'll get into ownership as well in addition to that. But can you give the average day to day or week to week walking into the pharmacy, starting the day, going through the task, and then closing and going home?
Yeah. So, it's pretty much similar to your regular pharmacist job. When you come into the store, you would have your queue, you have your fax queue, you have your telephone queue, making sure that all of the prescriptions are processed. You would have phone calls from doctors and patients, and you would have to try to return the phone calls. And so once all of the prescriptions are processed, going through the retail workflow of things, you would move them into the lab, and from there, as a compounding pharmacist or compounding technician, is your job to look at the different guidelines and look at the different procedure or master formulas and say, hey, this is what we need. Look them up. Sometimes you do them often enough, you may not even need to look at the formula because they're right in front of you. They're like on the PCCA website, but some medication, there's only 2 ingredients. Other medication, there's 3 or 4 ingredients. So just depending on which formulation you encounter that day. And then from there, go and you would pull the medications, read the procedures, and kind of you make the compound. So that's how it is. And pretty much by the end of the day, what your goal is to get caught up with all of your work, make sure that everything is done, make sure that, you have all of the prescription ready for pickup. Some patients say, I like to pick up on the same day, or I like to pick up in 15 or 20 minutes. So you have to prioritize those requirements, make sure that prescription get done in a timely manner, because if you don't prioritize them correctly, you will have, patients and doctors that are upset that prescriptions are not done on time.
That is a quick turnaround.
Yes.
Oh, wow.
On average, a compound typically takes, 15 to 30 minutes to do just a single compound. At the end of the day, hopefully you get everything caught up, and then, the pharmacist would arm the whole pharmacy and close the pharmacy and just walk out from there.
Okay, so pretty standard. It's just what you're doing with the medications throughout the day is different. And what is the ratio like of pharmacists to technicians on the average? I know the weekends are probably different with less volume, but during the weekdays, what is the supported staff looking like?
Yeah, so it just varies from pharmacy to pharmacy. At Professional Arts Pharmacy, we typically have at least 4 or 5 pharmacists every day on duty, 4 to 5 technicians working. So it's a 50-50 mixture, basically. The good thing about having a large group of colleagues working alongside you is that sometimes you would encounter questions that you're not sure, or you've never seen a compound before. You you kind of talk among yourself and you're like, hey, this is the best way to proceed with this. So it's always good to have a group of staff or colleague that you can work alongside with instead of trying to work as a one-man army. Is tough because it's a lot.
Is there rotation of responsibilities throughout the week? So would a pharmacist maybe a couple of days be in the back room doing the compounding, and then maybe they're in the front, at the front store?
Yeah. You want your staff to cross-train in different areas. Of course, you have different stations, you have different formulations, different areas of like you have the retail pharmacy where we help to answer questions for patients, taking call from doctor offices. You have the compounding aspect. So yes, sometimes you would rotate the staff and make sure that, everybody is cross-trained because the pharmacy has to keep on running despite, we have one or two people going on vacations.
I would like you to share your biggest challenges and also your biggest successes. We'll talk about the biggest challenges first. And you can answer this either as a compounding pharmacist or as an owner. But what have your biggest challenges been thus far in this industry or along your journey so far to get to where you are now?
Yeah. So of course, with every field, there's a lot of challenges, with ownerships and, compounding pharmacies. The regulation always changes. It's you always have to kind of keep afloat with new informations. There's always something new out there that you have to stay afloat. And, it's all about time management, making sure that if you don't have a good work-life balance, work will consume you because it's never ending. There's always something that comes up. There's always things to do. There's always people to meet, deadlines to follow, and there's always something. So you have to have a good work-life balance and be able to triage and prioritize some things. It's hard to kind of get the staffing in and get that person up to speed as fast as you want it to be. So sometimes, like I said, the training takes time, but once you have the right staffing in place and you can run a smooth operations, there are so many rewarding moments, with compounding pharmacy and, entrepreneurship. You help a pet or you help a patient get better, seeing that you have a good team of people to work with. Doctors are able to come to you and say, wow, you were able to help to save my patients, or you were able to make an impact on my patient. That makes your day. And then it comes with, the freedom to, of course, do things how you want it to be done. We want to alter a way of practice. We put a plan in place and it goes in within the same week.
And I wanted to ask, for those who are interested in pursuing compounding pharmacy and they want to make sure that they are keeping their options open for future pivots that they might want to take, where can you take this knowledge? Say they've been working for 10 years in a compounding pharmacy and they're like, you know what, I think I would like to do something a little different with my knowledge, my expertise. Are there other avenues that they can take their expertise outside of working in a pharmacy?
Yeah, just depend. Once you have those skills, you can look at hospital jobs. There are compounding pharmacists that work in hospital to create, different formulation like TPN, IV drips, IM injections. You can look into entrepreneurship. If you look onto entrepreneurship, you may have to look inside, maybe partnering up with somebody who's already in business, or, if you have the risk tolerance, you can start a pharmacy. You can also look at, like being a consultant for compounding pharmacists or compounding pharmacy owner. So those are the paths that you can go into, just depending on what your needs and what your requirements are. You say whatever makes you happy.
Oh, and I'm sure they also, I just thought about it, academia, they can become professors. They can help teach labs for students.
Yes. That's definitely a pathway as well.
Okay, so great. They can look into ownership. They can go into a different setting if they still want to be hands-on. If they maybe want to just take a step back from the hands-on pace, they might do academia or consulting. So they have options. They have lots of options. And as the owner, are you still involved heavily with jumping in with the staffing and keeping, your knowledge fresh by making sure you're still getting your hands, I won't say dirty, but hands involved with the compounding?
Yeah. So yes, the answer to that is you want to stay involved, because if you are not involved, you cannot fill in the gaps when there are gaps, like especially when people go on vacations or when you need to step in to help. So as an owner of a compounding pharmacy, you should be familiarize yourself with the different areas of compounding, because eventually, you know, you will have the gap on the schedule where you have to come in and fill out the gap. Of course, you can work as much as you want or as little as you want, assuming you have the right staffing in place. Um, but the goal is to be able to fill in and float between the different areas. As an owner, you would have to step in and say, I can help out with this, or if you're not there for whatever reason, you got to make sure that you can rotate the staff in place to make sure that the pharmacy is still covered.
So your week to week, I'm sure, looks different. I'm sure you're more involved with the ordering, making sure the inventory is appropriate. You're also doing client relations. Can you give us an idea of what your week to week looks like, juggling all your different hats and then also stepping in the staffing role?
Yes. So yes, that's a really good question. As a staff pharmacist, your week to week doesn't change as much, but as an owner, you have different things that come up, different requirements. Let's say you want to be in a pharmacy 5 days a week or 6 days a week. Your schedule may say, hey, things have to be done outside the pharmacy. Let's say you have to, do a lot of paperwork or getting certain type of CE training, responding to email pertaining to, the Board of Pharmacy, FDA, or DEA. So there's a lot of multitasking involved. Like I said, your schedule, you could wake up one morning and intend to work in the pharmacy, and then you get emails say, hey, this has to be done, or there's a deadline that we have to meet, and so it kind of altered the schedule immediately. So it's not really like a set schedule. You kind of take it 1 week at a time and trying to make sure that you meet all of the deadlines, all of the obligations that comes with being a pharmacy owners. And sometimes, of course, you don't get to leave at 5:30. You have to stay back and get things done. Or if you're not at the pharmacy, sometimes you could work until 8 or 9 p.m. So it just kind of depend on the day to days. It's like not every week is the same.
Okay, so sometimes you might be taking work home with you
Yeah.
afterwards.
Yes, definitely. You could be taking work home with you. You could be at the gym and an email comes up and you have to pull out your laptop and work at the gym. So it's different. It's not like a 9 to 5. It is a job with large high amount of degree of responsibility, and a lot of people depend on you for answer, and sometimes it's has to be done.
Yeah. And how did you learn how to own a pharmacy? Who taught you the ins and outs of ownership?
Yeah, so I went to University of Georgia. I had a minor in business, and I trained with at the University of Georgia. I trained in entrepreneurship. I was able to visit different pharmacies when I was in school and kind of learn how to operate as an owner, how to operate as a manager. And before doing all of that, was a pharmacy manager. I was a district manager, so I kind of step up the ladder. Kind of learn what it's like to manage, the different pharmacies. I think from there, it kind of help you to reinforce your skill,
Yeah.
and you just take those same skills into owning your own pharmacy.
When you were getting your minor in business, was that in undergrad or?
No, that was part of like pharmacy.
Oh,
So you
did it do it?
yeah,
Yeah.
yeah. No, well, I don't have an MBA. Just like a minor in business. So it's not like an MBA, but what you do is you would, you have like business courses that you would take, and you have like entrepreneur courses that you would take. And, these courses would pay off in the long run, is because they teach you a lot about the business side of pharmacy. You don't get to see a lot of the business side of pharmacy as a student. Most schools will not even touch that subject, and it's pretty hard to learn, especially if you never seen it yourself. But with the training I received, I was able to look at the financial aspect of pharmacy, look at, I guess, the background of running a pharmacy, and not just doing the day-to-day thing of hustling and bustling. I was able to kind of build upon those skills and kind of took on pharmacy ownership.
Okay. So it sounds like you kind of knew early on that you wanted to one day own a pharmacy.
Yeah, I think I did. I mean, even if you don't want to own a pharmacy, I think the skills are great to have because at the end of the day, you have to be able to understand the different business metrics, the different financial report like profit and loss statement, balance sheets, how to evaluate your business. They're great skills to have because you can take these skills anywhere, not just in pharmacy. You can take these skills and look at the companies in the S&P 500 or the NASDAQ and, evaluate how the companies are doing.
That's awesome. I don't think I knew that, or if you told me that before, I definitely forgot it. But that's awesome. So, what about for people now? They've already graduated. They're not going to go back to school for reasons we understand. What is another way that they can learn about ownership without going through a formal academia program?
You want to look for free courses or free training. Like I said, there are training programs out there. I mean, they consider themselves like continual educations that you can do. I think they are rare though, because like I said, a lot of pharmacy CE training kind of revolve around, clinical aspect. Another thing is to partner up with someone who has the experience and, go from there and say, hey, I want to be a partner or, get training, become a pharmacy manager or pharmacy district manager and be able to run the different operations and the different financial reports. How do they come in? And like I said, there's not really a way to learn unless you have to kind of perform it. You have to go out and kind of get your feet wet and become the pharmacy manager or, the operational manager of a chain or a pharmacy to be able to learn and kind of grow from it.
So it sounds like they're likely not going to have opportunities just fall in their lap. They're going to have to be proactive and seek and find either formal programs or people who are willing to take them under their wing or partner with them to get that experience.
Yes.
Okay.
Yes. I mean, that's with everything in life, there's no substitutions for doing it.
Yeah.
When you do it, you kind of learn it. It's reading it from the book and seeing the videos would be nice and all, but doing it in real life is different.
Yes, it is.
And there's no substitution for that. You have to perform in real life.
Yeah. Do you seek partnerships with the community or with different providers, or how do these relationships get established where now you are the reputable pharmacy for this provider's office or in this geographic area? How do those relationships form?
Yeah, so you have like different conferences that you would attend every year, attended by a lot of OBGYN doctors, conferences attended by a lot of veterinarians, conferences attended by a lot of podiatrists. So you kind of go on to these conferences and you kind of network and meet these doctors and say, hey, this is our pharmacy and these are the services that we offer. You also like run online marketing campaign and, you can also run a lot of sponsorship events for the community. Say, hey, I would like to sponsor an event for autism, different events that you can sponsor and kind of get your name out there.
Mm-hmm. That's good. Anything else to share with them that I may not have been able to cover in the questions that I asked you? Any parting wisdom?
I would say just, get out there and get in contact with some of the compounding pharmacies or compounding pharmacy owners and just say, hey, I'm interested in joining, these are the skills that I have, what does it take for me to join? And, I guess if you have the willingness and are persistent, you will get it eventually.
Thank you so much for sharing your wisdom, your years of experience with them.
Thank you for having me, Dom.
Oh, I'm so happy. This was a very highly requested area of pharmacy that people are interested in knowing about. I just went online, compounding pharmacies near me.
Oh, okay.
And then I saw that you had so many different populations that you serviced and specialties. And I was like, oh, this would be amazing because he can speak to so much and cover a lot of bases and what people are curious about right now. And then found out it was a drive away. And I was like, oh, I hope he says yes. So thank you for saying yes.
Oh, no, you're welcome. Yes. Thank you for having me. And, like I said, I'm in Ellicott City, Maryland. So if you have questions about compounding pharmacy, feel free to, send it my way.
Well, we want to thank you for watching. As always, stay blessed and stay curious. And we are out.
Thank you.
You just watched an episode of Pharmacy Pathways, a podcast created to help current and future pharmacists find their happy place in life. I'm your host, DomThePharmacist, and I interview different pharmacists from various careers, asking them the questions you'll likely need answered in order to know if that particular role aligns with your interests, passions, skill sets, and talents. If there's a specific topic or career you'd like to see featured, you can let me know by filling out the audience feedback survey on my website. And if you'd like to be a guest, there's a guest sign-up form on my website as well. Both of those links are in the episode description. Thank you for watching. Stay blessed and stay curious. I'm out.